recommendations. In general, we always recommend certain lifestyle changes like eating better, losing weight in people who smokes. We always try to encourage them to quit because that's one of the main risk factors to develop complications. So if somebody is able to do that, to quit smoking, usually the risk drops dramatically. So that's usually what we do on the initial evaluation to see what kind of patient we are facing, if the patient has a lot of risk factors or not. And then depending on that, we determine if we are going to recommend to prescribe a medication. And not everybody with abnormal cholesterol levels needs a medication. On the other hand, the patients who have a lot of risk factors can greatly benefit from treatment. And also, I always try to explain to patients that the main goal of the treatment is not just to make the cholesterol lower or to look better, but is to decrease the risk of having complications, decrease the risk of having either life-threatening or disabling complications. Talking about medication, there are multiple drugs that can be used to lower cholesterol. There are products that can lower cholesterol. However, not all of them have proven to decrease complications. So I normally try to explain that some products may lower the cholesterol. That doesn't mean they will prevent a heart attack or decrease the risk of a heart attack. So I always try to make that clear. And then we commonly face patients who are very hesitant or afraid of taking a particular medication. And I always try to explain that although the concerns are valid and we understand and we have seen the side effects, the vast majority of patients do well on the drug. And we normally, even if something bad happens, if there are side effects, normally we have ways to decrease this. Either we can always stop the medication, we can replace it, we can always lower the dose. So there are always options if somebody needs to have the cholesterol managed. I mean, if you have other risk factors, probably one of the worst things is to ignore it because sooner or later a complication may happen and sometimes you regret not paying attention to these things earlier on the process.